Hello guys, this is me Luqman Khan and today we discuss pharmacological effect of acetylcholine or pharmacological effect of muscarinic agonist or pharmacological effect of parasympathomimetics. These all are same. It means pharmacological effects of acetylcholine. So first we discuss effect on GIT. What is the pharmacological effect of acetylcholine in gastrointestinal tract? In GIT there is gland and smooth muscle. So the gland which is present in the gastrointestinal tract is salivary gland and gastric gland. Salivary gland muscarinic receptor activation occur when acetylcholine act on it and salivation occur. In gastrointestinal gland, when acetylcholine act on it, muscarinic receptor activation occur which increase HCl secretion and peptic ulcer occur. In smooth muscle, there is longitudinal smooth muscle and circular anal sphincter or circular smooth muscle are present in the gastrointestinal tract. In longitudinal smooth muscle, muscarinic receptor activation occur which can lead to contraction and increase peristalsis. And circular smooth muscle in the anal sphincter, muscarinic receptor activation occur which can lead to relaxation. So, increase in peristalsis and relaxation can lead to colic, defecation and diarrhea. Colic mean pain in the intestine, defecation mean discharge of feces from the body, and diarrhea mean discharge of feces frequently in liquid form from the body. Effects on respiratory system and respiratory system, bronchial gland are present and bronchial smooth muscle. In bronchial gland, muscarinic receptor activation occur which can increase bronchial constriction. In bronchial constriction, increase intrinsic asthma. In bronchial smooth muscle, muscarinic receptor are present which can lead to bronchoconstriction or bronchospasm. Bronchospasm means muscle that line the bronchi are so much tight. As a result of tightness, wheezing, coughing, and other symptoms occur. So increase in bronchial secretion and bronchoconstriction or bronchospasm can lead to intrinsic asthma. Intrinsic asthma is not due to allergy, it is due to overstimulation of parasympathetic nervous system. Wheezing sound is due to shortness of breath which can be heard by ear, while bronchospasm is not heard by ear. For hearing bronchospasm, we use stethoscope. This is the difference between wheezing or wheeze sound and bronchospasm. Effects on urinary system. In urinary system, smooth muscle are present in the wall of the bladder and circular muscle are present in the urinary sphincter. Smooth muscle in the wall of the bladder, also called retrosor muscle, and retrosor muscle muscarinic receptor activation occur which can lead to contraction of retrosor muscle which can lead to micturition or emptying of urinary bladder from urine. And circular muscle in the urinary sphincter, also muscarinic receptor activation occur which can lead to relaxation of circular muscle which can lead to micturition or emptying of bladder from urine. Effects on genital system. In male, muscarinic receptor in male are present in erectile tissue. So, in erectile tissue, muscarinic receptor activation occur which can lead to erection. In female, muscarinic receptor are present in the smooth muscle of uterus. So, muscarinic receptor activation occur which can lead to uterine muscle contraction. So, in male, it can lead to erection, and female, it can lead to uterine muscle contraction. Effects on CVS or cardiovascular system, especially in heart. In these effects, first we study heart rate, then rate of conduction, then force of contraction. So, what is a heart rate? Heart rate is number of heartbeats per minute, and normal average heartbeats is equal to 72 beats per minute. And normally, it is between from 60 to 100 times per minute for adult person. What is a rate of conduction? Rate of conduction is the transfer of electrical impulses from pacemaker to whole cardiac muscle. The transfer of electrical impulses from pacemaker to whole myocardium. This is rate of conduction. And force of contraction is the intrinsic ability of the cardiac muscle to develop force at a given muscle length. So, the term used for heart rate is chronotrophy, for rate of conduction is romotrophy, and for the force of contraction is ionotrophy. So, if the heart rate decrease, it is called negative chronotrophy. If the rate of conduction decrease is negative romotrophy, and if the force of contraction decrease, it is called negative ionotrophy. So, in effects on CVS or heart rate decrease, rate of conduction decrease, force of contraction decrease. So, all these decrease can lead to decrease in cardiac output. So, cardiac output is decreased, which can lead to drop in blood pressure. So, now we study effects on eye. In eye, there is lacrimal gland present and intraocular gland present. In lacrimal gland, muscarinic receptor are present, and activation of muscarinic receptor can lead to lacrimation. So, muscarinic receptor contraction can lead to papillary constriction, which is also known as meiosis. And muscarinic receptor contraction in the ciliary muscle can lead to decrease the diameter of the lens, which can lead to accommodation for near vision. So, papillary muscle contraction and decreased diameter of the lens both can lead to accommodation for near vision. In sweat gland, also muscarinic receptor activation occur, which can lead to increased sweating.